Hello, today we're going to be talking about strokes. Most of you may be familiar with the concept of what a stroke is. You may have seen somebody with a paralyzed hand, paralyzed leg. Sometimes the whole side of the body can be paralyzed, either the left or the right, and this can affect the way they walk. And for other people, they can't even manage to walk. You also know that most strokes are associated with things like diabetes and hypertension. And we're seeing quite a number of people with strokes in our days because of complications from these diseases that we have mentioned. Of course, there are also other causes of strokes that have nothing to do with diabetes or hypertension, but mostly in our setup, we're talking about people that are diabetic, hypertensive, or very overweight, obese in short. So what is a stroke generally? Well, in medical terms, we say that a stroke is a cerebrovascular accident. Big word, eh? Yeah, cerebrovascular. Cerebro refers to the brain, vascular refers to the blood. Now, just to give you a bit of basics to help you understand this, you'll be interested to know that you have generally, an adult has about 5 liters of blood in the body. And you'll also be interested to know that the blood network in the blood spans about 100,000 kilometers. Yeah, that's quite significant. In an adult, of course. Children are a bit different. So 100,000 kilometers of blood vessels and 5 liters of your blood is constantly being recirculated in that distance. The speed of blood itself, blood moves at about 2 meters per second. So you can see how fast that is. So if blood is moving through your blood vessels at such a high speed, can you imagine what would happen if there was any immediate obstruction along the flow of blood? Yes, you can have a catastrophe. And that's what we call a stroke. So sometimes what happens is that you can have a clot forming in your brain, and that is going to disturb the flow of blood to brain, causing damage to your neuronal cells, or your brain cells to be simple. Or you can have a blood vessel rupturing. And then when the blood vessel ruptures, the blood goes outside the vessel, and that is going to cause injury again to your brain cells, causing brain damage. So that's what essentially what a stroke is. It's just brain damage secondary to a vascular problem or a blood vessel problem. Either you have a blood clot forming, or you have a blood vessel rupturing and then causing the problem that you've already mentioned. What symptoms can you have? Well, most people can present with inability to talk. Okay, they can present with weakness on one side of the face. They can present with weakness on one side of the body. Yeah. But not all patients are going to come to the clinic with a full-blown stroke. Others have a warning, and it depends on how quickly they respond to that warning. This is what is called a TIA, a transient ischemic attack. So for some people, they may have signs that are telling them that you're about to stroke, and you have to slow down on whatever you're doing, and you have to seek medical attention. So how could you know you're having a TIA? This is what is referred to as FAST, F-A-S-T. Okay, so F is for the face. Okay, if you start seeing facial weakness, that is suggests that you could be having some ischemic damage to your brain. If you're having arm weakness, that could be a sign you're also having some damage. Okay, speech, all of a sudden you can't speak properly. And then for a TIA, the T stands for time. So for a TIA, the symptoms you've mentioned, the facial weakness, the arm weakness, the speaking difficulties, they all resolve in a period of 24 hours. In most people, it even resolves in like 30 minutes or so. So have you ever experienced such, the things we've mentioned, facial weakness, you can't speak properly, arm weakness, that resolves continuously? You may be having TIAs, and it's just a marker, or it's a warning that you may have a full-blown stroke, and you want to be able to do those beautiful things that you like to do. So what should you do? Well, go to the hospital. When was the last time you had a BP screen, for example? When was the last time you had your blood pressure checked? When was the last time you had your sugar checked? Because one thing that predisposes most people actually to having diabetes and hypertension, the things that are commonly going to give them a stroke, is because of the things they eat. Now, if you look at our YouTube channel, you're going to come across videos where we talk about how carbohydrates can cause this, how fats can also cause this, and what role exercise does. So you've heard it for yourself. Strokes are real, and some people die for them, others are left disabled quite permanently. So take care of yourself, and remember to have yourself screened. So don't forget to download your MedSearch app on Play Store. The MedSearch app helps you to find the nearest place that you can go for that BP screen, for that glucose screen. Okay, the MedSearch app can also help you find out where you can get a specific drug that you may be prescribed to buy. Better still, it also helps you to know where you can go and get vaccinated. So don't miss out. What are you waiting for? Everybody's jumping on the message app.